Ms. Kusendova, thank you again for talking to us about what's happening with this crisis. And as always, let's start with numbers. The cases, hospitalization, ICU occupancy, and of course, vaccines.
Well, it's my pleasure to be here as always. So today's numbers are 3,166 cases in Ontario. So we are seeing that number plateauing. The 9-day average has been around 4,000 or below. So according to our health modeling data, which was presented just this past Monday, we are starting to see some plateauing, which we're very happy about. What we're not seeing is a rapid decline of the numbers. And so that's why we still need to be very, very vigilant. Today's cases include 876 new cases in Toronto, 817 in Peel, 300 in York Region. And today our ICU occupancy due to a COVID-19 related illness is 858. So that number is still quite high. We want to see that number decrease to ensure the sustainability of our hospital system. But the good news is that to date, we have administered 8.9, almost 6 million vaccines in the province of Ontario. So we are truly, spearheading those vaccination efforts. And I know that in the month of May, especially in my region of Peel, the first 2 weeks of May, we will be receiving close to 50% of the provincial supply. So we are receiving almost 500,000 additional doses of vaccine for the region of Peel, which is a major hotspot. So we're truly, every day we're vaccinating about 15,000 people, which is 1% of our population here in the region of Peel. To date, we have vaccinated about 45%. And so we're hoping in the next 25 days to get towards that magic number of the 70%. We want to be around 70 to 75% to see that herd immunity take place. And so the month of May will be very big in terms of our vaccine rollout in the region of Peel, but also across Ontario. So there are some really positive trends happening in our community. And of course, time will come to review our stay-at-home order, which I believe is supposed to elapse on May the 20th. And so at that point, dare I say, if we are seeing these positive trends continue, perhaps we'll be able to, put an end to the stay-at-home order and have somewhat of a semblance of a summer. So there is reason to be happy.
I want to talk a little bit about the COVID deniers and the anti-mask protests that unfortunately happened. What can you tell about these?
Well, for those COVID deniers that are out there, I would say come and visit my emergency room or come and visit a local ICU unit where our nursing staff, our doctors, and all of our allied health supporters have been working day in and day out for 13 months now, helping our patients, helping families. Of course, many people have passed away from COVID-19 in the province of Ontario. So dare I say that perhaps those COVID deniers perhaps have not had a death in their family or experienced COVID for themselves, because I can assure you, if they took a walk down in our hospitals, perhaps their attitude would be different. When it comes to the masking, we know that outside is safe. Masks are not needed outside unless you cannot physically distance. Then we are asking people for outdoor activity to wear masks if you cannot physically distance. So, when you're going outside, it's okay to take off your mask, but it's truly, especially for those who live in condominiums, for example, when you have to go inside of an elevator and you're very close to other individuals, we're asking, it's part of the public health measures to continue wearing your mask, and especially in workplaces such as factories, manufacturing, and other places where physical distancing is not possible. And frankly, anytime when you are inside with another individual, the public health guidelines right now are that we should be wearing masks indoors. Of course, in our hospital system, we've been wearing masks for the last 13 months, and we have very strict masking protocols, and that's how we were able to keep our staff safe in the first place. So, there is light at the end of the tunnel, but it is not a time now to not continue being vigilant. We need to continue following our medical experts.
I know you work in the hospital as well, and I would just want to ask, it's more personal. How do you feel What's the atmosphere there? Like how the doctors and the nurses are coping with the situation? How do you feel after a working day there?
Well, thank you for asking that question. And, I will preface this by saying that May the 1st was Doctor's Day. And next week, which is May 10th to May 16th, is Nursing Week in Ontario. And I just want to express my gratitude on behalf of the Premier and all of my colleagues to our frontline heroes that have been really working so hard for the last 13 months to protect us from this virus and to take care of the very ill and vulnerable patients that we have in our healthcare system. I do have to tell you that there is a huge fatigue among my nursing colleagues because they haven't had rest for the last 13 months. I feel like this pandemic has truly showed, I guess, a divide in our society where half of the population is working from home and experiencing their own challenges with that, change in routine. A lot of moms are working from home while trying to school their children. We're all on Zoom calls and we hear the dog barking in the background or the baby's crying. We've changed our daily routines, but the other segment of the population are our healthcare heroes that have not taken a break for the last 13 months. So there is a huge amount of fatigue, and I know that sick calls have increased and absenteeism to work has increased because, frankly, nurses are tired. Imagine trying to work in a crisis mode, but the crisis keeps on going. It's been 13 months. And so, I just have to say I'm so grateful to my nursing colleagues and physicians and all of our healthcare heroes for continuing to work so hard. And that's why I say to all those COVID deniers and, anti-maskers, keep those healthcare heroes in mind. Every time you're making that decision, a frivolous decision that could impact the health and well-being of other Ontarians, think about that nurse that will have to work harder as a result of your actions. So that's my message to Ontarians. And once again, thank you to our healthcare heroes.
Are there any nurses that are coming from other provinces? There was a news a few weeks ago about that.
Yes, so we were very fortunate to receive through the Canadian, I believe through the Canadian Red Cross, they came to us from Nunavut, if I'm not mistaken, somewhere where it's very cold. I know we had a contingent of ICU nurses come to help us here, I believe in the region of Peel and in Toronto, to help with some of the burnout that has been experienced by our staff. It was a group of about 20 nurses that came, which is great. We could certainly use some more. And I know that our Trillium Health partners, for example, in the region of Peel, have been working very hard to provide additional training for existing nurses to upgrade their competency to be able to work in the ICU. And our government has been funding that training as well across Ontario. So for those nurses that feel that they want to get upskilled and get more trained up to become ICU nurses, which is a very, very highly specialized area. I remember when I was a nursing student, I did my consolidation at an ICU at the Toronto General Hospital in the transplant unit. And let me tell you, sometimes I felt, especially during night shift, that I was in a sci-fi movie because those patients are connected to 16, 17 tubes, monitors, beeping. It's a very, very highly specialized area of nursing. And so it does take a toll when you have to work in a crisis mode for such a long time. So I want to encourage any nurses out there that are interested in pursuing this field of study. There is currently some funding through the government of Ontario to get that training and to help our COVID-19 response that way.
Thank you very much. And let's talk again next week and hopefully with better looking numbers.
Absolutely. Thank you so much.